was about 55% of the world's GDP. So you could imagine Zheng He was born in the world #1 superpower. If Zheng He decide to discover the new continent, imagine, could he make it? My answer is yes. But how come he did not make it? So this is my question. Why it's Christopher Columbus and not Zheng He that discovered the new continent of America? My answer is attitude. Attitude is everything. How come I brought the issue of attitude? Because attitude has much to do with the fight against COVID-19. So you see, how come Taiwan is a success story? I just list several major reasons. The first important, and to me the most important reason, is the so-called awareness raising. The whole nation is very, very aware, is very alert to the virus. In other words, we know the danger of the virus. We know how dangerous the virus could be because some of you just put it, Taiwan has some bitter experience fighting against SARS in the year 2003. That's about 17 years ago. At that time, the one who led the fight against SARS is our today's vice president. He is a specialist in virus, in epidemiology. Okay, so this is one good reason the whole nation take the virus very seriously. So again, attitude is the key, because attitude decides one's altitude, decide what you have to do. And I think the second thing about the good, victory in Taiwan is the so-called transparency of information. So I think honesty, again, is the best policy, especially in times of crisis. Facts matter most. So honesty reporting to us and to me is one of the keys of success. And you might, if you watch, the television, you might realize Taiwan's Minister of Health and Welfare, okay, the cabinet holds press conference on daily basis, usually at 2 o'clock in the afternoon, to describe and explain to the audience, to the citizens, the latest situation of the pandemic. So I think, this is something probably for many countries to learn, the so-called honest reporting, the transparency of information. Now, from the newspaper, we might know that several countries, especially the United States, Australia, are pointing their fingers at China just because they thought China didn't have transparency of information, didn't do the honest reporting about the virus. So this is the second, issue I want to bring up. Then, again, the third, key point is Taiwan adopts a unified national strategy. Later on, I can explain the flow chart of this national, structure. So, in other words, we have one uniform strategy to fight against the virus. And what is more important is Taiwan, we have a very trusting community. I think the key to success is whether the people, the community can trust the government or not. And also, I think we take the so-called proactive precautionary measures very early. Okay, I think just before the Chinese New Year, it's about late January, early February, when Taiwan learned about what happened in Wuhan, China. Then we start to take some proactive precautionary measures. So the pandemic precautionary measures started early, and new technologies, especially the social media, are used for contact tracing and for other purpose. So here I just want to bring up one important issue. Here is the so-called totalitarian surveillance versus citizen empowerment. In other words, would you like to depend on surveillance system to control, to track, to trace the citizens, or you want to make, to empower the citizen, to make the citizen willing to work together, to cooperate with the government? I think this is, to me, is a very important issue. Fortunately, in Taiwan, we adopt the so-called the policy of citizen empowerment, even though we also use some technologies for tracing, for contact tracing, but that's not for surveillance. And also in Taiwan, over the past 50 or 60 years, we have very strong sector in medical science. So medical related resources in Taiwan are sufficient, and healthcare professionals actually are of very high quality. So that is the reason why, in Taiwan, the best young talents actually, probably like in Indonesia, go to medical school. So all the professionals from medical school, we can say they are the best talents in Taiwan society. So also we have a very comprehensive national health insurance system. It covers for all the citizens. We have very good hospital systems. We have very quality medical professionals. We have very good information system. All this put together are adequate and advanced. So the government can quickly depend on these resources to combat the virus. I just give you one example, like the government use resources, big data from the immigrations, from the medical information record, either to trace or to stop the virus. Okay, and then also I mentioned the willing cooperation of a well-informed public, and I believe this is the real secret of Taiwan's success. We love to cooperate with the government because we are well informed of the situation. And then we also take some very unusual measures, like when it started, the government realized we need facial mask. So in the very beginning stage, the government, control the export of facial mask. Even today, we ban, okay, we don't allow the export of facial masks unless for non-profit, donation. And we also increase the production of facial mask. So even though Taiwan already is the world #2 largest producer of facial mask, but compared with China, we still need the mask. So the government at the very early stage took full control of mask manufacturing and production lines. The government purchased mask manufacturing equipment and signed contracts with manufacturers to help boost the production. So through this experience, Taiwan has formed a national team for this purpose. So now we have produced more than what we need in terms of facial masks. And if you read from the newspaper, you might come to realize Taiwan now start to donate facial masks and some other, equipments for this purpose to other, countries, even to Europe, to the United States. And another health, happiness, Taiwan, it's natural. It's easy for us to wear a mask and to wash hands whenever possible. I think, this all helps. So I'm going to go through the details, but before I go through these details, I think I can pause for some minutes for some of you to raise the issue or to raise the questions. Thank you. Okay.
Moderator.
Yes. Do you have any question that I would like to raise in terms of just a few slides I just shown?
Yeah.
Yes or no?
Hello, Prof.
Yes.
Prof. Chen.
Yes.
This is Ulin.
Yes.
I have questions. What about the people moving from one area to other area? As you may be aware that Indonesians country has what we call it the situations that the people can easily, because they live in one regions and should go to other region due to the working office is on other region or district.
Yes.
How about what about the Taiwan's facing this challenge?
I think we have the same problem too. But fortunately, even after the outbreak of this virus, our life has been quite normal. All the schools, including the primary school, secondary, or even the universities, we postpone 1 or 2 weeks for the start, for the opening of the semester. But after this, everything goes as usual. So I've been in the university for more than 12 weeks. I've never done my work at home. So I love to do that, but I have no opportunity. So people move from one city to another to work, and they take public transportation, they take train, they take MRT, except they are required to wear mask. So so far, the production, the school, the manufacturing, even the service sector has remained about the same, except not many people want to eat outside. So I think the industry that's hit the most severely is the hospitality, the restaurants, but otherwise about the same.
Prof. Dan, can I ask something?
Any other question they want to
Yes.
raise about
Yes.
what I just mentioned?
Yes. Can I ask something, Prof. Dan? Hello.
Yes.
Okay. I really respect to the community commitment to keep the attitude, what you call attitude. It's very important for combating this COVID-19. So the role of community or people is very central or very important. And the second is how your history related to SARS in 2003 can really affected this condition, affected this COVID to combat this COVID. Thank you.
Yeah, I think human beings learn from past history, and for SARS, we did suffer a lot. Several medical professionals died because of SARS, and some hospitals were just locked down at the time, and for very simple reason, because at that time SARS, again like this virus, also started in China, but at that time it's in Guangdong province, not in Wuhan. But because of the tense of the relationship across the straits, Taiwan had no access to all the information. Okay, so we are fighting in the dark. And that's the reason why we suffer a lot. Hundreds of people died because of SARS. So starting from that period, Taiwan government realized we need to build like quality hospitals, all kind of, so I think, experience helped us a lot. And that's the reason why I emphasize the so-called honesty reporting, transparency of information. If we can share all the information, I think we can, try to stop, the infection of the virus.
Thank you. Dinjan, there are 3 more questions from those participants who already raised their hands.
Sure.
The Dean has more additional question. Then we would like to, what do you think? Pak Budiono, do you want to add some more question? There are 3 more.
Yeah. I have one question. Okay, thank you very much. The step in Taiwan is very clear, I think, because the policy is also very clear. But in Indonesia, I think it's hard to understand if the policy can be implemented to the community. So you have a suggestion for the Indonesian, what we can do, for example, for the people, for the government, or the something else. Thank you very much.
I think, you can call me a good friend of Indonesian people. Okay, I've been to Indonesia more than 15 times. Okay, Asia University even has a education center, Taiwan Education Center in Surabaya. And I myself have been to Undip, for example, more than 4 times. Okay, and from my contact with Indonesian people, from my contact with friends in Indonesia, I come to realize actually your people are very friendly. Your people, love fun, but sometimes when the virus situation arrives, you cannot just love fun. You need to take it very seriously. And so, even today, we have students from Indonesia study at Asia University now. And sometimes when I meet with these students, they always tell me, Chen, don't be too serious. The virus is okay. To us, it's okay. But this is my impression. So I think, people need to take virus, because how dangerous the virus could be, we are not experts. We cannot tell. So serious attitude, the so-called awareness is important. And number 2 is probably, the transparency of information. Sometimes when I travel to Indonesia, sometimes I want to get some kind of information. So I want to ask some kind of information, but it seems to me, I simply cannot get it. So obviously transparency might still be the issue. I'm not sure. If transparency, honest reporting is not the issue, then I believe your country can do far better in combating the virus.
Wow, thank you.
Okay.
The highlight is take the problem seriously, and we have to be honest in reporting and recording. That's a good point. Do you still have some question? But if it is okay, then we can move to 3 more audiences who already raised their hands.
Okay, it's enough. Okay, it's enough.
Okay, Mbak Avicenna, and then Mbak Fitriana Yuliawati, and then Mbak Ade Mutiara. So Mbak Avicenna, please. Silakan Mbak Avicenna. Mbak Fitriana dulu sambil menunggu Mbak Avicenna.
Terima kasih Bunda. Thank you Prof Chen
Yes.
for your sharing session today. I'm very excited to know that about your country. I'm very amazed to know that Taiwan has no new local positive case for 30 days and no local transmission per se. As you explained earlier, that the 3 point from Taiwan is awareness, the attitude, and the transparency of information. And we have like we call it in Indonesia is gugus tugas or task force. We do have press conference on daily basis also, like Taiwan do in current days. But the most important is who is the leading for the unified national strategy in Taiwan, because like Dean said earlier that Indonesia have the trust issues between government and the community. Can you explain for this issue? Thank you.
Okay, thank you for your question. Okay, before I answer your question, I just want to pose some questions for you to think about. If you ask people to make a choice over health, okay, or privacy, what kind of choice would people make? You know, on the one hand, you have health. On the other, you have privacy. If you ask people, okay, now make a good choice. If you do you prefer health or do you prefer privacy? Actually, this is the issue many governments today ask their citizens to decide. But to me, this is the wrong issue to ask. How could we ask a citizen to, you know, make such a choice? Of course, as a citizen, I prefer, you know, health over privacy. But my point is, this is not the right question to ask to each citizen. We can have health and privacy at the same time. And when I bring up the issue of privacy, that means if we respect each one's privacy, then the community, the people will start to trust the government. So again, the trusting issue, okay? So in Taiwan, like in Indonesia, we also have different political parties, okay? You have vote for number 1 or for number 2 in Indonesia. In Taiwan, we vote for Blue Party or the Green Party too. But the key point is, even when it comes to the COVID-19, it's not the political party, it's not the politicians, it's not the president or the vice president who controls, okay, or who spread the information. It's an expert committee led by the Minister of Health and Well-being. So I think, you know, in Taiwan, in terms of COVID-19, politics doesn't play a part. Instead, expertise is the key. So we trust those people. They are experts in medical areas. I think, you know, this could be the answer to your question.
Thank you.
Next, please, Mbak Ade or Mbak Avicenna. Silakan.
Okay, thank you very much. This is Ade.
Okay, so yeah, please.
Okay. Hi, Prof. Chen. Thank you very much. It is very impressive how your country managed people through trusted government to make no local transmission in the past 30 days, you said. And what I want to know, how many population in Taiwan and what social media platform that government use to trace the people movement. If so, how big the coverage of this platform to trace all citizens and how effective to make people follow the regulations. And the last question, is there any consequences or fine or punishment to the ones who didn't follow the regulation? Thank you, Prof.
Okay, I think, compared with Indonesia, Taiwan is a very small country. Okay, you have more than 260 million people, right? In Taiwan, we have just total, we about 1/10 of your population. Okay, 1/10. Okay, one person, 10 Indonesians, one Taiwanese, 10 Indonesian. Okay, so Taiwan is a very small country, but the good thing is, over the past 50 years, Taiwan has developed into a high-tech society, especially like, our computer, our semiconductor, our, mobile devices. We are the major exports of all these high-tech products to the world. So the government can easily rely upon high-tech technology, to help prevent the infection or the spread of the disease. But I think the most effective for the government to trace or to track the people is our national health system. Everybody, when he gets sick, when he need to go to the hospital, he need to produce like more or less like a credit card, a card called national insurance card. It has all the data of the person's health condition. So we use that as a way to track for contact tracing. And you also mentioned, do we have penalty? Yes, we do. And the penalty, if you violate the regulation, like we, for example, like if you have contact with confirmed cases, you need to stay at home for 14 days. We call home, isolation. Or we can, if the case is less serious, we call self-health management. But it is more serious, we call home quarantine. If you violate the regulations of these three types, if it's a mild violation, you will be fined, let's say like, probably $5,000 US. Okay. Wow. But if it's a serious one, okay, it could be 500,000 US. So it depends on how serious. Okay.
Okay, what do you think? But Ade, is that okay? All the questions are.
Thank you very much. It's really explain my questions. Thank you very much. Appreciate it.
Mm-hmm.
Okay, so next question comes from Mas Gonga, and then Mas Fatur, and then Mbak Luvita. So please stay on board. Mas Gonga.
Okay, thank you, Ms. Hanifa.
Okay.
To ask question for Professor Yinghuei.
Yes.
I know the key of to combat COVID-19 is discipline. It's about discipline is characteristic of from Taiwanese people. How to make Taiwan people discipline to order with government order or the rule that Ministry Head of Taiwan? How to make the people, especially Taiwanese people, discipline to order the government? Thank you.
So you're talking about the obey of the regulation, right?
Yes.
Okay. I think because Taiwan has been quite democratic and law-abiding country, so we have developed that kind of attitude. If you violate the some kind of regulation, you get fined, you get punished, you get penalty. To us, it's a matter of course. We take it for granted. So also, I said because the government from the very beginning has remained very open-minded. No under-table information. All the information is released. So as a community, as a citizen, we are well informed of all the situation. And if I want to run the risk, I want to violate the regulation, I receive penalty. And actually, some citizens in Taiwan did receive penalty. Some, when they got the penalty, some tried to run away. Okay, then they got caught at the airport, and then they have to pay for the fine before they leave Taiwan. So we did have, I think, about 10 people did get penalty from the government. Some mild one, some very heavy one. So Taiwan so far has been quite law-abiding.
Thank you, Prof, for your answer. Thank you very much.
Okay.
Mas Fatur, next please. Mas Fatur, silakan di-unmute. Mbak Luvita, next please.
Okay, thank you, Prof, and Mbak Hanifa for the kesempatannya. So I have a question for Professor Ying.
Yes.
In Indonesia, as I know, the problem that our government face isn't just about the health factor, but also the economic factor got the damage too. According to your presentation, there's an economic step to make Taiwan's government survive, which is the point number 8. Control the export and increase the production of facial mask. Instead of that step, would you give another economic step that Taiwan's government has took to facing this pandemic? Thank you.
Okay. I think as I said in my presentation, even after the outbreak, every sector, both service or manufacturing, have remained about the same like before. So if you read about the figure of our export, actually over the past 3 years, almost remain about very stable, okay, in terms of, but 2 or 3 sectors are heavily hit, like transportation, especially the airliners, okay, the restaurants, the hotels, okay, hospitality sector, for example, they are heavily hit. So the government also came up with the so-called rescue budget for this, in particular for these sectors. We also offer like taxi driver, for example, just give you one example. For taxi driver, because people dare not to take the taxi, so for each taxi driver they get 20,000 of our currency, okay, 20,000 a month for a period of 6 months as compensation from the government. So the government does offer compensation to the people who work in the sector which are heavily hit, not because of Taiwan, but because Taiwan is an export-driven country, because we cannot export things overseas because of the lockdown of cities, of countries in other areas. So rescue budget or compensation budget has just passed our, law making body. So for those who suffer most, they receive, rescue budget from the government. But I think in terms of economy, I want to emphasize again, because all the sectors, manufacturing and service, have been operating. Okay, so I don't think, if all the countries open their market, Taiwan can bounce back very quickly. This will be my answer to you.
Thank you, Prof.
Okay.
Any other question from other audiences, or you have some more question, Mbak Dahlia? Is it okay? So, Mbak Avicenna, are you going to still ask the question? Welcome, Mbak Bagoes, the chair of the doctoral program in public health, and also welcome the Secretary General of the Indonesian Public Health Union, or PERSAKMI, Mas Rahmat Wageno. Okay, so yes, Mbak Fitri, please. You have one more question, right? Okay, go ahead.
Oh yeah, thank you. Terima kasih Bunda. Thank you, Prof. Chen.
Yes.
Does Taiwan impose social restriction? Secondly, how do Prof opinion about related to lockdown or a form of natural herd immunity? Thank you.
You're talking about, do we have social what? What's your first question?
Social restriction.
Social restriction. Okay.
Yeah.
I think Taiwan, like many countries, we practice like some ban on foreigners. Like today, even the situation in Taiwan is cooling down. But even today, we do not encourage foreign people, especially tourists, to come to Taiwan. If you need to come, it's okay. But unfortunately, you need to stay in the hotel for 2 weeks before you can travel. Okay, so I don't think you like to do that, to travel to Taiwan for 2 weeks. But in the first place, you need to stay in the hotel for 2 weeks for isolation. Okay, so we do practice this. In our own country, in our society, we prohibit some big events to take place. Like we have very important religious festival, like your Ramadan today, right? We have different Ramadan, but in our own religion, the government doesn't encourage, this kind of event to take place. And as I said, because our community is willing to cooperate, willing to work together with the government, so they just suspend the several major religious events. And today we also, observe indeed the so-called social distancing. I have class yesterday, but I try to place my student, with some distance so that they won't become too close. Okay, this is what we have been doing.
My second question, Prof.
Yes.
About how about your opinion about herd immunity?
The what?
Herd immunity.
Health immunity.
Yes.
I don't think I'm in a position to answer this question. I'm mostly a humanity person, but it's just reported, and I read the report some time ago. It said that how come Taiwan so far has a very low death rate. Also, not just Taiwan, also India too. If you read the number in India, they also have a very low death rate. And that's because, when we were just a baby, we received, it's required all kind of injections, okay? And some injection against like flu or whatever, they say help to enhance our immunity system in our body. And that could be the reason why. But to be honest, in terms of medical, in terms of this epidemic, I'm not in a position, I'm not expert to answer you this question.
Thank you very much, Prof. Chen. Yeah, it's enough. Thank you. Terima kasih, Bu.
Sama-sama. Ada lagi yang mau bertanya? Ada Mbak Krisdiana, Pak Bayu, Mbak Krisdiana, mahasiswa doctoral program. She's our students and a doctoral program of public health. Please, Mbak Krisdiana.
Yes.
Silakan. Boleh bahasa Indonesia, boleh bahasa Inggris. Di-unmute dulu, speakernya di-unmute dulu.
Sorry about that. Terima kasih Ibu Hanifa. Good afternoon, Prof.
Yes.
My name is Krisdiana. I didn't follow your presentation, but is it possible for me if I talk about the education, especially vocation education?
Yes.
Okay, thank you, Prof. How Taiwan keep maintenance the skill of the student who study in vocational study, because now, for example, my student, they study from home and they don't have many tools or many tools for practice the skill that they need as a midwife or as a nurse, something like that. Thank you.
Okay. I think, as I said in the beginning, Taiwan schools are all open. Okay. Even after the outbreak of the virus, we have never closed the school. Okay. So all the students, primary school students, secondary school students, and even university students, they all go to school every day. Okay, except weekend. Okay. And if some university, they say, okay, the virus could be quite serious, quite dangerous. Some professors choose to deliver their lesson online, but there's one limit. If your course requires students to use their hand to practice, okay, like, an internship, for example, or laboratory, for example, then that course cannot be taught online. They have to come to school to learn. Okay, so the good thing, probably just did not, watch my earlier presentation. I just said from the beginning of the outbreak, Taiwan school have remained about the same. Okay, so we have like at Asia University, almost all the Indonesian students are here on campus. Okay.
Okay, Prof.
And if we are talking about like vocational school, actually in Taiwan we have two types: vocational school and comprehensive school. Then our percentage about 50-50. 50% of student population are for vocational school. Another 50% of students are for comprehensive schools. So in Taiwan, vocational school has been much emphasized, even when students move to senior high. So starting from senior high, we have vocational school. University, we also have two types, University of Science and Technology and Comprehensive University.
Okay, Prof, according you, when our country choose the student learn from home, so what we have, what the technique that could for our student, Prof, to keep the skill?
Actually, yeah, if you do it online, it's very difficult, like midwifery, right? They have to go to the hospital to practice. But if you do it online, it's not easy. So that's the reason why the Ministry of Education in Taiwan requires, if it's hand practice, if it's internship, you have to do it in person, not through online. This is the requirement. Okay, and I think probably in what you can do is, if students, because the virus, they cannot do it at the moment, but you still have the summer break. Make use of the summer break as the third semester. You have the spring semester, you have the fourth semester. Actually, in Indonesia, you can create the third semester. Summer is the third semester. And for those who cannot do the internship, who cannot practice in the lab, they can do it in the summer when the virus dies out.
Okay, that's enough, Prof. Thank you.
Okay.
Terima kasih, Ibu Hanifa.
Sama-sama, because in Indonesia we have only semester old and even atau semester ganjil and semester genap. So I think there is to be next on more discussion on how to keep the skill and competency for the vocational schools.
Yeah.
This is like a good idea to raise this issue that we have to also forward this issue to our Ministry of Education, Mas Nadine. So, is there any question? Because I think the chair of the study program, the head of the study program, Pak Bagus, do you have any question too? Okay, so
Okay,
Pak
thank you, Bu Hanifa.
Pak Bagus dulu atau Pak Bayu?
Do you hear
Pak,
me?
silakan Pak Bayu, Pak Bagus.
Hi, Prof.
Yes.
Thank you. Giving me the occasion to ask the questions. Seems like that Taiwan have a very good behavior in obeying the government's directions toward the COVID-19 preventions. I wonder whether Taiwan has experience. That's why they have a very good behavior on it, or maybe the government have a very specific the way to give an education to them, so that the people, all of the people, will obey to do the protective behaviors towards the coronavirus. Can you give me some explanation about this, Professor? Thank you very much.
I think your question raised up the issue of trust. Trust is the key. Can the people trust the government? Okay, so if we choose to trust the government, the preliminary condition is the government needs to be trustworthy. So that's the reason why we require honest reporting from the government. We require experts sitting in the government delivering all important information about the virus to the people. So I think it's the trust issue. So I said we have very trusting community just because the government has honest reporting, has transparency of information.
Okay.
So, yeah, so that's the openness of the governments in giving all of the information about the what is going on and something like that.
That's right. Yes. Yeah, the government should not try to hide, from the people.
Okay, thank you very much.
Okay.
Thank you, Ms. Hanifa.
Thank you, Pak Bagus. And Pak Bayu, before I think Dean Chen still has some more slides, but Pak Bayu is going to ask a question. Please, Pak Bayu, Dr. Bayu Usman.
Thank you, Prof. Chen.
Yes.
I have some question. You have mentioned about the Taiwan National Health Insurance, that every citizen must have it. Okay.
Yes.
What about for the low level and the unemployment? Whether they have to have the kind of health Taiwan National Health Insurance.
Okay.
That is first. The second is the Taiwan government has implemented the how to fight against the COVID-19. Is there any obstacle and improvement that might have if there is a second outbreak happens?
Okay.
Thank you.
Okay, talking about the national health insurance system, I think about 6 or 5 years ago, when President Obama, the former president of the United States, tried to reform the national health insurance system in the United States. Obama, in particular, referred to Taiwan's national health insurance system as his model. Okay, how does it work in Taiwan? Okay, you will be charged for the fee, but depends on your salary. Even our international students, like students from Indonesia, after they've stayed in Taiwan for 6 months, they can enjoy our national, insurance, health insurance system. But because these are students, they do not have salary, so they pay minimum a month is about $25 a month. But they can go to any hospital, small hospital, big hospital. They can see any doctors, famous or less famous, when they get sick. But if you have better salary, okay, then you pay more. Like me, for example, student pay $25 a month. I pay $250 a month, 10 times, okay? But we enjoy the same kind of benefit. We go to the same hospital too. So in Taiwan, this national health insurance system is more or less like mutual, help system. So the rich help the poor, okay, that kind of system. So I do believe, because of this good system, so it also helps a lot in fighting against this virus. You are talking about if the second wave of outbreak comes up in Taiwan. Are we ready for that, or do we have any obstacles? Actually, when the outbreak started early, February or late January this year, the only obstacle, the only protests actually come from some minority people who live in Taiwan. They argue you could not stop any traffic between China and Taiwan. Okay, so they ask the government not to stop the traffic, but the government decided to stop the traffic between the two sides to avoid any infection, to avoid any introduction of the virus to the island. So in the beginning, the protest came from some minority people. That could be the obstacle. But through these 2 or 3 months, all the people are aware the virus is serious. The virus it can mean death. So I don't think, even if the second wave of outbreak happens, I don't think there will be much obstacle or much protests.
Thank you very much.
Terima kasih. Ada pertanyaan berikutnya?
Hanifa?
Yes.
I need to ask you some good advice.
Yes.
I prepare altogether 34 PowerPoint slides. Okay, I just focus on the main issue, but I have technical issue, right? So my question to you is, because we are running pretty late, so would you want me to send to email the PowerPoint slides to you, so you share all the slides to all the participants, or you want me to continue? It's up to you. I'm at your disposal.
Yes. We are okay if you still have time, because there is no time limit actually, but I just consider if you still have time, then we would be happy to have another presentation from you.
Yeah,
Okay.
to me it's okay.
Okay, now.
Okay, okay. So I start with some other presentation.
Yes, and share your slide, please. Thank you.
Okay. Okay, so can you see it?
Yes, it's in the process.
Yeah.
Stop sharing. Yeah.
Okay.
It's a little bit.
Oh, okay. A little bit slow, right?
Yes. Our internet is not as fast as Taiwan's.
Okay.
I haven't seen, but it's still like started screen sharing.
Yes. Me is okay now. So 哎，这里写停止共享，为什么？
这里写停止共享，就是你按下去就停止了。现在这个是共享，已经共享。
Ready for you? Not yet?
Not yet.
Not yet. Oh, I'm sorry.
Yeah.
Me here is already ready.
Would you please stop the previous one?
Okay.
And then we start again. Usually
Okay,
the
okay.
yeah.
Okay, I try that. 重来.
Okay, now coming. Okay. Yes.
Is it okay now?
Yes.
Okay. So you see, this will be my table of contents for the presentation talking about Taiwan government's policy against COVID-19. But I arranged, by time, so you can see the timeline, when it gets started, how we did it, and later on how we try to improve it. And then we have some precaution material from the government for promotion, for propaganda. We also have we also practice social distancing. So we have some tips, and these tips also promotion piece from the government. Then we have three types of to cope with or to combat the virus. The first mild one is called health management of self-management of health. Then we have home quarantine, we have home isolation. And because we are at the university, so I also mentioned Asia University precautionary measures against COVID. Okay, so I think this is Taiwan government's policy. This is the structure of the organization. We have organization, and after the I'm going to show the organization first. This is the organization, central government's organization chart. We have the commander, and the commander is not the president, nor the vice president. The commander is the minister of health and well-being. Okay, in other words, the commander is the expert. We have the vice commander, we have the convener of expert meeting, and don't forget we have altogether 9 teams: epidemic monitoring team, border guarantee team, community epidemic prevention team, medical response team, material team, R&D team, information team, administrative team, and press team. All these work together. This is from the government. So this talks about the organization. And then when it happened, very beginning with the so-called travel warning. And we, after the first is the travel warning, later is the travel suspension. Then how the government do the monitoring and to the contact tracing. And then we have the guarantee policy, we have the mask policy, we have the transportation policy, we have the crowd control policy, we have social distancing policy, we have some just ask violation penalty, we have medical treatment related policy, and education is mostly from Ministry of Education and focusing on Asia University. Okay, so in terms of the travel warning, we started very early, January 21st, okay, when we learned about Wuhan, virus. So it's travel warning to level 3. So we are advised not to go there. And then about a week later, this warning raised to the whole China, okay, China travel. And after that, more cases develop in other countries. We have South Korea, we have Italy, we have Iran travel, then we have Europe, Middle East, North Africa, then we have Asia, North America, Oceania, etc. And finally, on March 20th, global travel warning to level 3. In other words, not just to some specific countries, but to the whole world. With travel level 3, that means if you insist on traveling, you need to get some special permission. If you do not get special permission and you still insist on traveling against the warning, notice, then you will get some kind of penalty. And then this is after the warning. Finally, it's more serious stage is the so-called travel suspension. Just stopped, okay, just stopped. So with Wuhan, it's quite early, okay, 2 days after the travel, warning is suspension, okay. So the government suspend any trafficking between Wuhan and Taiwan. After this, between China and Taiwan, this is just 1 day later. And during these days, as I just mentioned, some minority in Taiwan did protest against the government. How come we stop the gateway to China? Okay, but later on, all the people understand the seriousness of the issue. And then 1 or 2 weeks later, the entry of residents from China all suspended. Just give you some, time, line about travel suspension. And then we have the monitoring, okay? Monitoring, especially, inspection of passengers all inbound flight from Wuhan first, starting from Wuhan, okay? And then later on, starting from all other countries. This is so-called monitoring and contact tracing. I think the good, success in Taiwan is once, a confirmed case is reported, then the government by new technology will trace back these persons' travel history, contact history. So all the suspects will be advised to either stay at home or to stay somewhere to isolate themselves from the rest of the people. This is called contact tracing, and we have done this very successfully. Okay, and then this is our quarantine. Okay, we use electronic monitoring for home isolation and home quarantine. We have cell phone with GPS. Okay, so it's easy for any patient to get notice, to get advice, to get information from the government about what to do. Okay, not just for domestic, also from other, tourists from other countries as well. After this, we have the so-called facial mask, and we started this very early, January 21st. Taiwan government imposed a temporary ban on the export of facial masks to secure enough supply of masks for Taiwan citizens. I think, wearing a mask especially, in this case, is very crucial. It's very crucial. Okay, and we have several, stage to reform the practice. At first, it caused some chaos because all the people would rush, to the store to buy the mask. So we have the so-called mask rationing system. Eventually, the name-based rationing system. If I want to buy mask, I need to present by a national health insurance card to get it. Okay, this is how we manage the facial mask practice. And then public transportation, okay, passenger require, on trains or intercity buses to wear masks, okay. If you go to the highway, the same. And then, we have like 100 people and 500 people. If you indoor gathering, you need to wear mask, okay. This is, the so-called mask policy. And then we have, some people talk about the violation penalty, okay. Violation penalty, this is the money, okay. From, 100,000, okay, to 1,000, okay. So it's a big money to us too. And then I think to relate to medical treatment, not just for the penalty, Taiwan is the fourth country here to successfully extract virus strain from patients, up to China, up to Australia, up to Japan. So that is the reason why we believe very soon we can have vaccine made from this extract virus. So vaccine is one key issue. We are trying to produce, after vaccine, the drug, okay, the medicine, and then also the testing. I think these are the three things Taiwan is about ready to produce, okay? So you can see this related so-called rapid diagnostic tests, medication, and vaccine. And I just give you some idea about this. Okay, education. The only thing that happened to education is Minister of Education postponed the opening of primary and secondary schools until February 25th. Originally, it was scheduled to open February 11th. So 2 weeks postponement. This is the only, inconvenience caused to primary and secondary schools. University postponed the opening from mid or late February to, early March. So in terms of education, all the schools are open, only 2 weeks postponement. And then in terms of instruction, the MOE allows school to implement flexible study management and allow students to take courses online. Actually, online courses in Taiwan are highly regulated in the sense that we are allowed to take a certain percentage of courses online. Not all the courses, not all the credits can be taken online. But because of the outbreak, the government MOE implements some flexibility. So we have two types of online instruction. One is the so-called synchronous. Okay, the government advises us to use Microsoft Teams. Okay, for non-synchronous, we use the Moodle system, the university system. We have these two types. Of course, some schools also use Zoom like you are doing now. But you might realize, actually, in Taiwan, the government doesn't encourage us to use Zoom for security reason. Okay, you are the host, you use Zoom, and I'm the speaker using Zoom, it's okay. If I'm the host, I cannot implement Zoom myself because of security reason. Okay, but this is how we, teach. And then also we have a standard for school suspension. For example, if senior, junior high school, primary school, kindergarten, etc., have a class with one teacher or student, as confirmed cases, then the whole class will be suspended. Okay, if a school has 2 or more confirmed cases within 14 days, the whole school will be closed. With the university, the same. So we have some kind of, regulation. Okay, 1 confirmed case, the whole class need to be closed. 2 confirmed cases, the whole school need to be closed, but closed, of course, for 2 weeks. The only university in Taiwan that has been closed for 2 weeks is National Taiwan Normal University, because they happen to have 2 confirmed cases. 1 confirmed case happened to be a student from France as an exchange student. And then social distancing. We have this, the so-called poster for social distancing. So we have tip 1, tip 2, tip 3, tip 4, like keep a 1 meter physical distance indoors, a 1.5 meter physical distance outdoors. Travel with your face mask. Always wear your face mask in any face-to-face conversation. Avoid group dining, for example. These are the tips for social distancing. Okay, and these are the posters produced by the government for the same purpose. Okay, the same. Okay. Precaution material from the government, and then also from the government, some in Chinese, some in English, some bilingual. Okay, so I think, this is a typical, health management in Taiwan. We have 3 types. The very mild one is called self-management of health under 14 days. The less mild is so-called under 14-day home quarantine. Okay, the most serious one is home isolation, and all the detailed regulation are listed here. And then for Asia University, we have also the organization. We have some precautionary measures. We have personal health declaration daily pass. I think this is something perhaps university or high school or school in Indonesia can learn from Taiwan. I am going to show you this. And then we have warning notes for the danger of infection during the spring vacation. This is the vacation for crowd gathering. And we have some caring measures for our international students, because the school, Asia University, is still open, okay, to international students. And okay, so we have the commander. The commander is the president, the rector himself. We have the spokesperson, director of Public Affairs Center. We have vice commander, the vice president, etc. Okay. I'm also involved here, part of the the organization here. And then okay, I think this is something for Indonesian school to learn. You see these 3 daily paths. Okay. Asia University is the open university, but in order to contain the virus, all the faculties, all the staff, all the students need to show their health declaration form or pass every day when they enter the university. Okay, so if the color is green, then that means safe. If the color is yellow, then we need to be careful. If the color is red, any personnel are not allowed to enter the university. Okay, how come you can get a green or you can get a yellow, you can get a red? They give you some survey question, asking about your travel history, asking about your contact history, asking about your symptom. Do you have any symptom related to flu, related to COVID-19? If some mild symptom is developing, then you'll get this one. If more serious, then you'll get this one. Okay, if you are okay, you get this green. Over the past 2 months, every day I obtain this green daily pass. So that's the reason why I'm here in my office, for this video conferencing. And I think we have some precautionary measures, okay? And actually, you see, this is our desk to control all the entrance of students, okay? Even if the student, you know, we don't have to take their temperature. We don't have to measure whether they have high fever or not. The machine, the computer, the screen will detect. So we use a lot of machines to save human labor, okay? And this is like our warning notes for the danger infection of COVID-19 during the spring vacation. And we have several, you know, caring measures for international students. I believe Hanifa, as the former dean of public health, also received my notes. Actually, as the dean of the international college, I sent almost one note, one message to all the international students to try to give them the so-called honest reporting about the situation in Taiwan, the situation at Asia University. Okay, and this is some other, you know, carry measures. So I think, you know, I promised to deliver all the PowerPoints to Hanifa. So if you want to go through in detail, you are more than welcome. Thank you.
Thank you very much. This is very comprehensive presentation. Is there any question from somebody? Because this is already 1 hour 52 minutes. So I think if we can round it into 2 hours, then we still have 8 minutes or 5 minutes for a question. One question, please. Mas Siswanto, silakan. What is the strategy that has been carried out in preventing the peak of COVID-19 from the side of government, society, business groups, and families? And this is from Mas Siswanto. There is a question.
Talking about a strategy, I think in my earlier presentation, I mentioned already, we have the so-called unified national strategy to fight against COVID-19. So the government, you know, when they follow the development of the virus, like every day or every 2 days or every week, it depends on the development, the government would announce nationwide the policy. Even social distance is a policy by the government. Social distancing, like wearing mask, like I just mentioned yesterday, some county already, you know, lift the ban of wearing facial mask. You don't have to wear if you choose not to. Okay, so the ban was lifted 2 days ago. So the government have a so-called unified policy depending on the development of the virus.
Okay. Itu Mas Siswanto. Any question, please?
Okay. Thank you. Thank you. Thank you. Thank you, Prof.
Any question? So the slide is going to be uploaded in the website of PERSAKMI and Fakultas Kesehatan Masyarakat. So kindly visit the website. So we're waiting for the slides from Dean Chen later, okay? I'm sorry.
Sure, yeah. I'm going to send it to you. Yeah.
Okay. So I think if there is other question. I think no more question. So Professor Chen and all the audiences who are joining from the beginning till the end, I think I would like to express my great appreciation and thank you very much, Professor Yinghuei Chen, or I usually call Dean Chen, for being with us and deliver a very great speech, and that we could share and we could also learn and we could also what we call it. Actually, we could just say, how can we learn from Taiwan victory and combating COVID-19? So, on behalf of the Dean of Faculty of Public Health, because they are not here, and also all the Indonesian Public Health Union, maybe Professor Ridwan Aminuddin, do you want to, would you like to convey a message or whatever? Or
Oh
closing?
yeah, thank you, Mbak Hanifa. Thank you, Professor Chen, for your sharing to combating COVID-19 in your country. It's very important to us to arrange our strategy to control COVID-19 in our country also. This very valuable information, valuable strategy how to make a new strategy in our country also. Thank you, Hanifa.
Okay.
It's my honor and my pleasure too.
Mas Rahmat, the
Yep.
Secretary General of the Indonesian Public Health Union, you want to convey a message or just speak up something about something?
Sudah diwakili sama Bang Prof, Mbak Ani, sama idem. Thank you.
Pak Saud, from the former Secretary General of the Directorate General of I forgot. Pak Saud from the Ministry of Manpower. Saya kira ada beberapa chat yang mungkin. Okay, sepertinya I think all the questions have been answered by Dean Chen, and hopefully we can learn something. And I really feel grateful and thank you very much for your presence and for being with us. And I would like to apologize for all the unaccidental or the what we call it, something that unpleasant happened, or because this is online conference that could be hindered by the internet connection and everything, and we actually had to set up in webinar session. However, accidentally we set up in a video conferences. So, however, with webinar, the internet usually very slow, but with the video conference, because we have just 100 audiences, then we can get a better visual and sound. So this is why some of the participants prefer to join in the YouTube streaming. This meeting is recorded, and we will also edit some of the term that may be unnecessary thing. However, all the slides will be accessible later. Thank you very much for being a wonderful audience, and special thank you for Dean Chen for delivering a great presentation. Thank you very much.
Thank you, Hanifa, for inviting me. It's an honor.
Thank you, Professor Chen.
Yes, thank you, Prof.
Bye.
Bye-bye.
Thank you so much.
Thank you so much,
You're
Paul. Thank
welcome.
you,
Yeah.
Chen.
Welcome to visit Taiwan.